The trends in U.S. healthcare are well known. Patient acuity and obesity are on the rise. Caregivers are aging and they're in short supply. That's why many hospitals, nursing homes, and healthcare systems are partnering with Diligent to make significant cultural changes to improve employee health and patient comfort and safety. Together, we're moving to safe patient handling. Diligent's program incorporates evidence-based clinical practices, the best equipment available, clinical expertise, exceptional customer and technical support, and the experienced, stable organization required to support healthcare facilities and IDNs. It is also endorsed as the American Hospital Association's ergonomic program. At the core of the program is the concept of minimal lift, which has been the standard of patient care in Europe and Canada since the early 1990s. Minimal lift incorporates ergonomically designed lifting and transfer devices and the processes and policies to ensure their use. Minimal lift controls bring quality of life back to caregivers who might be headed for injury or, at the very least, suffer from the perpetual aches and pains associated with traditional manual nursing practices for patient lift and transfer. But it's not just caregivers who benefit. Patients are universally safer and more comfortable in a minimal lift environment. Transfers are smoother. Falls are often prevented or reduced. Shoulder-arm injuries as the result of using arms as handles are prevented. Skin conditions are improved because there's less pulling of upper body parts during the transfer, and skin shearing is eliminated during turning and repositioning. Diligent's consultants have a diverse educational and professional background. They include certified occupational health nurses, nurses from other clinical backgrounds such as education, and physical and occupational therapists. Over 1/3 have master's degrees. Diligent clinicians provide strong, ongoing oversight, recommendations, coaching, and monitoring as an assist to facilities in maintaining their injury prevention program while they achieve the necessary cultural changes in patient handling practices. We know that cultural change, or the way we do things here, relative to patient mobility and handling practices, is a process that involves the persistent commitment of senior management, supervisors, and unit managers, as well as direct caregivers. We have only to think about caregiver use of gloves over the last 2 decades to recognize that changes may not come as quickly and as easily as we would like, but they do come. Diligent consultants understand the process and provide the necessary support. Implementation isn't the end. If it was, most facilities would simply revert back to manual patient handling within a few months. To help employees stay the course and sustain the program efforts and outcomes, we follow up with 3 years of monthly clinical support visits. A Diligent clinical consultant visits your program champions, literally making the rounds through each area and working in partnership with program managers, coaches, unit managers, and senior management to achieve injury reduction goals. They evaluate program compliance and address training, equipment, and patient issues. We call it gentle pressure relentlessly applied. We are just very persistent. In fact, we guarantee a 60% decrease in patient handling incidents, assuming the facility follows their own policies and use the equipment, or we refund a part of your program investment. Of course, all of the training and support in the world won't help if the tools are not operational, easy to use, and intuitive. Diligent is a clinical division of Arjo, the world leader in the design, manufacture, and sales of patient handling equipment. A full range of devices specific to patient acuity and size allows us to apply our philosophy to every transfer. Is it safe for the patient? Is it safe for the caregiver? Is it consistent with rehabilitation? Beyond transfers, Diligent also incorporates maxi slide sheets to help turn, boost, and reposition patients, transfer tubes, and hover mat air transfer systems for lateral transfers, and even compression stocking aids to make applying TED hose easier and quicker. Our goal is to address and eliminate every task possible that may injure caregivers. With all of the health benefits of the program, the best part of all may be the financial impact of moving to minimal lift. Patient care is OSHA's third most dangerous industry for frequency of incidents. The majority of these incidents are patient handling related incidents and soft tissue injuries to backs and shoulders. Consider this: a complicated back injury claim can easily cost $100,000 in workers' compensation and medical costs at any time. Uncomplicated back injuries typically cost $15,000 to $25,000 per injury, not to mention the cost of replacing the injured person during recovery. Moving to minimal lift, your system stands to realize a substantial reduction in these costs. Diligent customers reduce patient handling incidents and costs by upwards of 80%. Further savings may be realized in reduced recruiting and retention budgets because minimal lift facilities have a competitive advantage to attract and retain caregivers. When you take into account that the national average profit margin for U.S. hospitals is just under 4%, these recouped savings can quickly translate into $15,000 per bed in revenue each and every year versus current revenue. Implementing Diligent is a win-win. Caregivers get excited about the improvement in their quality of life. Patients like the consistency, quality, and comfort of care, and administration wins with enhanced cash flow. Together, we can create the cultural change that delivers significant benefits, enhanced community image, impressive revenue contribution, and improved productivity. At Diligent, we are leaders in safe patient handling programs. Partner with us today.